Here we are with my friend Dr. Chris Rago. If you've watched our introduction of Chris, you know that he is a doctor of chiropractic medicine. How many sports in college?
One sport.
Lacrosse, but you've done other things, right?
Oh yeah. Junior Olympic ski racing,
right.
Soccer, played at pretty much everything.
Exactly. So he is an athlete. He's a doctor of chiropractic medicine. He's also a PT, right?
Yep, I do physical therapy
and a trainer. So
Absolutely.
he's really versed with how this works. Now, what we're going to talk about again, sequence is lower body delivers front side. Glove, elbow, shoulder. Front side delivers the upper body delivers the arm. Arm is the last thing and the weakest link in the sequence. Now, Chris is going to talk about exactly what muscles we use in this upper body. I'm going to start with this. Big thing is we need to be in a leverage position up here, and he's going to give you the detail on this. Why? If I'm down here, merely down here, I can't fire these muscles. You want to
Sure.
go through that?
So basically, the most important thing to understand is that the muscles are designed to stretch and then contract. So, like you're saying, if you're in this position, everything's jammed up in the shoulder, the muscles of the chest, the latissimus muscles are all shortened. They're not at their full potential. When you bring the arm up here, now these muscles are allowed to stretch out, which give them more what we call potential energy. Potential energy turns into kinetic energy, turns into speed and accuracy of the ball. That's one of the most important things of why we don't throw jammed, why it's important to outstretch the arm.
I think the one thing I want to bring up, not to interrupt you, is what I talk about that since the sequence and leverage is that if you make a mistake in your body, then there's what I call compensation
Absolutely.
factor. And what happens is if there is a mistake, then the compensation, the load, goes to the weak link.
Right, exactly.
Okay, would you explain that?
Sure, so like you're saying, the legs drive the body, which drives the arm, which drives the ball. If that sequence is interrupted, now the body's energy, let's say, is not being utilized or performed at an adequate or appropriate level, putting excessive stress on the joints, especially of the elbow and shoulder, rather than allowing them to move. The joints are designed to move, and the muscles are designed to accelerate. If you change that order and affect that order,
what actually happens is it's a pull, and then we get some drive off the back leg. But what I always say, I weigh about 180 pounds.
Sure.
And what I say is if I get out of that sequence, then my arm, which weighs about 15 pounds, is pushing 165 pounds
Right.
rather than 165 pounds pulling that 15-pound arm.
Exactly. It's
the stress always goes to the weak link.
Sure, and it's important to utilize the body how it's designed. Sports in general are designed based on physical attributes, right? We're not playing sports that the body cannot do. We're playing sports that man created based on what the body can do. So, for the shoulder, for baseball throwing, utilizing the shoulder joint, the elbow joint with the muscles that move those joints appropriately are how we get the most accurate and highest level of performance overall, at any level.
And injury prevention.
Of course.
And by the way, I want to say one other thing. I want to point out that this is actually how the body's designed to throw.
Sure.
It's actually not designed to throw up here.
Right.
So the tendency, you look at almost virtually every Little League player, what he wants to do is come down here like this. He wants to be accurate, so he doesn't free up his arm into those positions.
Right.
He tends to be down here where he is going to be injured.
Sure.
Is that correct?
Absolutely. So you got to think about the different joints of the body and their functions. The elbow, per se, and the wrist mostly do a flexion and extension of what we call uniplanar,
right.
one plane of
right.
motion. Whereas the shoulder joint is a ball and socket joint. It's, picture a baseball in a socket like this. It can move in 160 degrees or 360 degrees, approximately. So that shoulder allows us to change the position in which the single plane joints can now function at a different level. When you're throwing sidearm, if we can just use you as an example,
right.
When you're throwing sidearm, a joint that's made to go like this is now being asked, right? This is the normal motion, same with the wrist, is now being asked to do this kind of motion.
Right.
Right? And just like the hinge on a door, it doesn't go that way. There's space in the joint, so it'll move a little bit and you can do it. Over time, over stress of that will injure the ligaments and the muscles of the forearm and even the shoulder.
Well, this is now, does everybody understand that this moves in a plane? What Chris is saying, correct?
Yep.
This is a hinge, so if I go this, I have to change, so I'm putting it in a weaker position.
Exactly.
Now also, remember we talked about pecs, lats, triceps. Sure. The tricep is always considered the throwing muscles and
Absolutely.
the obliques. Now when I'm going down here, I can't fire those in the same way. I'm relying more, am I correct in saying I'm relying more on the pec?
As I was saying earlier, in terms of the muscle strength, it's the position of the muscles. The pec major, the big muscle, the chest muscle, does this of the arm. It brings the arm across the chest. It doesn't bring the arm down, it doesn't bring it back. So when you're throwing sidearm, you're using that big chest muscle. However, the shoulder in general is designed to be utilized by the 20 muscles that are surrounded, right? So like you said, the tricep, the rotator cuff complex on the back of the shoulder blades, the pec major, what's called the pec minor, which is a muscle that's deep.
Right, sure.
And then of course the biggest muscle in the back, the latissimus dorsi, which does...
Show them where that is. Where is that?
So the lat, or latissimus dorsi muscle, is this big muscle right here. Right? It's the big muscle here. What it does is it brings the arm back like this. So it does that acceleration of the pitch. The rotator cuff complex are these muscles that attach to the arm. They're the muscles that are involved in slowing the arm down as the arm crosses your body. So if there's any abnormality in the way you're throwing, there's going to be an abnormality in the way that those muscles can act properly or react properly.
Well, and two final things. Number one, what I always tell kids, it's the same thing that we don't want. One of the things that we talk about with curveballs. We talk a lot about curveballs and say kids should not throw curveballs, and everybody talks about the injury, but there is a benefit to staying with the fastball,
sure.
And it's called specificity of training. If you're going to throw hard, you need to learn to throw hard, right or wrong.
Of course.
And whether you become a major leaguer and you use this, you need to have this tool.
Sure.
And if you don't, if you start throwing like this right away, you're not going to fully, and this should be the first tool.
Right. And back to what we were talking about, we can't go off of what Nolan Ryan's doing. He's at a level that's well beyond a 12-year-old. So you cannot mimic those types of motions.
Thank you.
Cannot mimic those types of throws. You know, Nolan Ryan's got a bit of a sidearm throw. Would you not say?
Right.
He's been throwing that way for however many years, 15, 20 years of growing up, right? So he developed that into a 100+ mile per hour pitch. Not every 12-year-old is going to be able to do that. So learning the fundamentals.
Well, this is a big, exactly. This is a big thing. We aid our skill development, our performance development, and we also stay healthy by doing fundamentally correct things first. No, nobody. If you're interested in baseball, you don't want to burn out at 12.
Right.
Okay. Now the last thing I want to talk about is, or have you talk about, is the growth plates. This is another. Sure. This is another issue.
Absolutely.
Because this is another reason. Now, I know actually a lot of advanced players. When I was playing college, I actually did not throw this way until I was in college, and what it was I had a sore shoulder, so I started doing this, and
sure.
all of a sudden, oh man, my shoulder feels good, and I started overloading this, and then my elbow feels bad. So explain to them, about where these growth plates are, and how that affects also.
Sure.
When we're younger.
The growth plate, everybody knows about growth plates. Every doctor, when you're young, talks about them. Basically, until, for a male, until you're about 20 years old, these growth plates are non-fused. So let's say the forearm bones, right? You have your radius and your ulna, two bones, they're long bones, they're like this. In you, that's one bone is the radius, one bone's the ulna. In a child who's below the age of, about 20 or so, whose growth plates are not fused, they have three bones. The bone, a growth plate, meaning the place where the bone can grow.
It's cartilaginous tissue there. Absolutely. Until it closes, right?
Sure.
Right.
And so what happens is that's how the bone's able to rapidly expand from this big to as big as we are.
Right.
And so that happens in every type of bone in the body. And so what happens is if you're throwing, the muscles will cross the joint, the ligaments cross the joint. If you're throwing improperly over and over again, you're no longer, like you and I, stressing one bone. We're now stressing 3 components of that one bone. And if you injure or displace that growth plate, that can lead to growth deformities, stunted growth.
And by the way, like you and I have talked privately, because Chris and I are friends, that people don't realize when an injury occurs in a young player, it's not like something snaps.
Sure.
It's not like you take a rope and cut it with a knife. There's fraying. Those tissues, they fray and they become weak over time through use.
The best thing about being young is that we're resilient. So like you said, you're not getting a lot of snapped bones. You're not tearing a lot of muscles. That comes later in life. That comes with the problems you create when you are young. So what ends up happening is you get more of tendinitis, irritation of the tendons, growth plates, joints, which will amount later in life, which will come back to get you. I see in private practice all the time. I've treated anyone from professional bodybuilders to professional baseball players and so on. And their injuries are overuse injuries. They're not high force trauma injuries.
Okay, this is where you get, I mean, I had a college, not a prospective college player, come in a year and a half ago, a high school junior that had thrown 260 innings over summer. It's a joke.
That'll do it.
It's a joke.
Absolutely. And the parents listening, you want to push your kids as hard as you can to get them to that next athletic level. You know that hard work, pushing, playing in the summer, playing in the spring, playing in the fall is how your son or daughter will get to that next level of sports. But burning them out, not giving them the chance to rest, not treating, mom, my elbow hurts, suck it up, play. That's where the injuries really occur. And
it's physical injuries, it's emotional, psychic injuries, because all we don't want to do things that hurt.
Sure. I played 3 sports in high school, and I played 3 sports out of school in high school. I was playing sports Monday through Friday for 4 to 5 hours after school every day. By the time I was 18 years old, I had torn quads, torn hamstrings, broken bones. I had more injuries than you could ever imagine, and was so burnt out of playing sports that it wasn't even enjoyable. It was like going to work. It was a job.
Right.
And I wasn't getting paid. I wasn't a professional athlete. I was in high school still. So there is something to be said about hard work, dedication, playing a lot of different teams, working hard. But too much could be detrimental.
And as we're saying, this is, by the way, see, we're saying develop. I think one of the keys of this is not even about sidearm throwing. It's about developing. It's about developing a skill that allows them to attain higher performance levels and also to keep them healthy.
The body's designed on habit, right? You create bad habits, you're going to stick with those bad habits. You create the good habits when you're young, you'll take those good habits through high school, through college, and even beyond if you're at that level.
Okay. Thank you.